studying for pharmacology from cerebellum, GRG source notes. First is, what is pharmacology? Pharmacology is the science which deals with the drugs. So there are two branches, right? So pharmacokinetics, which is the body on drug. For example, for example, pharmacokinetics example will be bioavailability, right? So whatever we study here, that is ADME study, right? Absorption, distribution, metabolism, excretion, that comes under pharmacokinetics. So it means that when a drug passes through the GIT, what are the changes, or what is, for example, bioavailability and all of that. So that is the pharmacokinetics. Whereas dynamics means because of the drug, what is the effect on the body. So effect of drug on the body. Next, pharmacokinetics we already studied is ADME study, absorption, distribution, metabolism, excretion. So coming to absorption, right? Absorption is the movement of the drug from the site of administration to the blood. Lipid solubility is the most important factor of absorption. So lipid soluble, if the drug becomes more lipid soluble, it can cross the membrane, hence absorption is better. So for example, when does the substance become, for example, if you are taking aspirin is a weakly acidic drug. So aspirin is a weakly acidic drug. An acidic drug is becoming lipid soluble in the acidic medium, means a like medium. So in stomach we have acidic medium, hence it becomes lipid soluble, hence absorption is better. But if they ask you any drug, where is it maximum absorbed, then the answer for it is always intestines, because of the large surface area. This is just for example. So acidic drug, acidic medium, it becomes non-ionized and lipid soluble. This is important. In non-ionized form, it becomes lipid soluble and hence crosses the membrane. Similar for basic drug, and acidic drug and basic medium, then it becomes ionized and water soluble, hence it cannot cross. Okay, bioavailability is a fraction of the dose that reaches the systemic circulation in unchanged form. For example, you are taking 100 molecule of a drug, for example 100 mg of aspirin, or you can take 500 mg paracetamol. So out of 500 mg, after the first pass metabolism, so what is first pass metabolism? A certain amount of drug gets metabolized in the liver, so that is called first pass metabolism. For example, 100 molecule, they have given an example here. 100 molecule you have taken, in that 80 molecule has gone to the liver and only 30 molecule has come back to the blood. So at the end, out of 100 you have only 30. So 30% is the bioavailability, means the percentage of the drug, it's a fraction of the drug that has reached the systemic circulation in unchanged form. It has not changed and reached how it is without any first pass metabolism, what fraction of the drug. Coming to the factors affecting, so factors affecting the bioavailability is, first is absorption, next is first pass metabolism. For what are the factors affecting the absorption? So first is bioavailability, right? So if there's more absorption, there will be more bioavailability, and decrease absorption, decrease first pass metabolism. If there is more first pass metabolism, it means less bioavailability. If more is gone to the liver, then it will be less available. For example, IV route, why does it have 100% bioavailability? Because it bypasses the first pass metabolism. First pass metabolism is not there in IV route, hence 100%. This is example of plasma concentration versus time graph. So here is the plasma concentration, here is the time. So if you're drawing like this, for example, at T max, maximum time taken for maximum concentration, C max. Okay, so this entire thing, whatever is the area under the curve, it represents the maximum concentration that can be achieved. Cmax is maximum concentration obtained by a particular dose, should lie between the therapeutic dose and the toxic dose and effective dose. Tmax is The time in which the plasma concentration becomes maximum tells about the rate. AUC is area under the curve, tells us about the area covered in the graph and extent of absorption. This is important. Then distribution. Distribution means it is a measure of amount of drug in the tissues after absorption in the systemic circulation. Depends on two things. One is lipid solubility, plasma protein binding. So more the lipid solubility, more is the distribution. Okay, first they are talking about plasma protein binding. For example, for acidic drug, A and A is albumin. Basic drug, it is alpha-1 acid glycoprotein. So higher the plasma protein binding of the drug, lower will be the volume of distribution. So for example, one drug is there, acidic drug like aspirin, which binds to albumin, right? Now more the aspirin binds to albumin, lesser will it be available in the blood. So more it is in plasma protein binding, lesser will be the volume of distribution. If it is there bound to the plasma proteins, then after this volume gets depleted, it can start slowly releasing this to the blood. Hence, longer duration of action. Why is there more drug interaction? Because since it's plasma protein bound, there can be other drug which is having more affinity, high affinity to that plasma protein. Hence, it can compete with that drug, causing drug interaction. And dialysis is not useful, since we know that albumin does not cross the glomerulus, right? It's a heavy molecule, does not cross over. Hence, dialysis will not help to remove this drug because it is plasma protein bound and it will be less filtered, similar line. Okay. So, in drug absorption, most common mechanism which we see is the passive diffusion along the concentration gradient. Lipid soluble ionized drug, where pH of drug is equal to pH of medium. This is that Henderson-Hasselbalch equation, where pH is equals to pKa, where 50% of the drug is ionized and 50% is unionized. Okay. Maximum absorption due to surface area, it is in the small intestine. Poor absorption is because of large size and hence it occurs in proteins. So we know that anything which ends with tide, ACE is always enzymes, tide is a protein, and MAB also, monoclonal antibodies, they are also proteins. So they are heavy molecules, hence poor absorption oral. Types of tablets, there can be three types, that is controlled release, sustained release, conventional. So usually what happens is, if you're taking one tablet, its concentration rises, then after some time it dips. It is conventional. In case of controlled release, they are formulated in such a way that they remain as a constant. This is because of drug is covered with a membrane. Okay, is covered with a membrane. And sustained releases, they start early but over a period of time, drug embedded within layers. Okay, so if there is any peak present, and it is going down, conventional release. If it's going up and then above, that's control, and below and above, this is sustained release. Okay. Okay, that's it.